Professor Dr Vivek Gupta, cardiologist, Delhi Apollo Hospital, say from the CCU of Apollo Hospital. Bed number 2188. You can see behind the ECG of a patient, and you can see, मैं इसको और close up करूँगा तो you can see कि it is having a white color. देखो हाथ से देखो बेटा, white वाले देखो spike. वाइट वाले स्पाइक है और एक ईसीजी है. नॉर्मल ईसीजी में वाइट स्पाइक नहीं होते. मैं और क्लोज कर रहा हूँ. शो द वाइट स्पाइक. ये वाइट स्पाइक्स है. ठीक है. सो टुडे इज डॉक्टर्स डे, 1 जुलाई 2025. तो वी हैव टू कीप एजुकेटिंग आवर सेल्फ एंड डॉक्टर. सो आज का विषय है कि पेसमेकर की ज़रूरत कब पड़ती है. आई एम स्टैंडिंग विद माई फ्रेंड मिस्टर अमित श्रीवास्तव, हु इज़ रिप्रेजेंटिंग ए कंपनी and which supplies the pacemakers. So the topic is why and when pacemakers. So pacemaker is a artificial pacemaker, is deployed behind the clavicle, just below the clavicle bone. It is under the subcutaneous tissue. It has got two leads. One lead is right atrial lead, another is right ventricular leads. It is known as dual chamber pacemaker. So dual chamber pacemaker is required in many patients who have got complete heart block or AV nodal block, or sometimes six sinus syndrome. What is six sinus syndrome, what is AV nodal block, and what is complete heart block? I will explain to you in a very short way. Heart has got its own electrical system. Heart has got its own electrical system which is governing the functioning of the heart. Electrical system. It is starting from the sinus node, which is on the right atrium, and through the atria it goes into the AV node, and from AV node it goes to the Purkinje fibers and the ventricle. So heart keeps contracting on its own because it has got its own pacemaker. It is known as intrinsic pacemaker. These intrinsic pacemaker system, at any age of the body, mostly after 60 or 70 years of age, they degenerate. They degenerate. That means the impulses which are starting from the system of the heart, the original God-made pacemaker system, they don't function properly. If it is the sinus node, the upper part of the heart, that is known as six sinus syndrome, and the heart goes into bradycardia. That means the rate of the heart will go down. Patient will have poor supply and patient can faint. This is known as syncope. If the blockage at the AV nodal, it will have complete heart block. Again, the heart rate will go down. The pulse will be only 30 to 40. These patients will go into syncope. Suddenly they have fainting and they fall down, and they can sometimes fracture their bones, and sometimes this can lead to sudden cardiac death also. This patient has got you can see, I have shown you that we have already done a pacemaker which is here, and this patient has got a pacemaker which is done very well, and now the pacing is done by artificial pacemaker which is deployed at the level of clavicle. So don't, if you are advised pacemaker,